All right, thanks for inviting me. I'm going to talk about something very different, very, very different. I'm an economist and do early childhood work, but I approach it more from a policy perspective. So let me try to cover quite a few things that I was asked to cover in not so many minutes. 4 points. Think broadly, think unambitiously, think cleverly, and think about promoting targeted programs under the guise of universalism, right? That was one of the things I was asked to talk about. So think broadly. You know, I think when we get groups like this together and think about programming for promoting early childhood development, we tend to think of service streams directed at parents, directed at the healthcare system, directed at early childhood education. And I would encourage you to expand this kind of conception, to think as well about economic support and to think about employment support. And in turn, because of employment and early childhood education, you have to bring in the kindergarten to age 16 education system. So, you know, the idea is when there's action on any one of these fronts that might produce improvements in child well-being, you want to be ready to go. With ideas for how best to approach that. I think you could argue that, and this is, we could have a discussion about this, but steady, well-paid employment for parents may be the best program we can put together for kids. And we've got policies that help promote steady employment and the rewards from employment. The Earned Income Tax Credit has been expanded. It's a very big program. It's shown to have direct links to child well-being. The Child Independent Care Tax Credit is another one that can promote employment and child well-being as well. On the economic support side, we know that economic stressors may be toxic for very young children. There's a wonderful study by Hilary Hines. If I had more time, I would describe it, showing that the rollout of the food stamp program in the 60s and 70s was associated, it's a nice, strong, quasi-experimental study associated with better health functioning, metabolic syndrome in adulthood. So these kind of programs that we think about as just helping nutrition for kids in the early stages can have been shown, in some cases, to have lifelong benefits. And then I'll talk about child allowance as another possible economic support effective policy. So think broadly. Policy decisions are being made across all of these domains, right? And I would urge you to be considering all of them to the extent possible. I hate to say this, think unambitiously. And this is from work that Gene Sterling and Julie Isaacs have done over the last 10 years or so. It's called KidShare. Gene Sterling is an economist, and he's gone through a very careful accounting of federal budgets over the course of the years and has tried to pull out the spending within every budget on kids. It's a hard thing to do. You know, we think of Social Security, for example, as a program for the elderly, but a lot of kids are living in families with elderly people who are receiving Social Security, right? So there's a certain fraction of Social Security benefits that is allocated toward kids, plus the more usual Head Start and so forth, direct expenditures. But if you look at this time series, the number of kids is actually fairly constant over this period. The baby boomers were bulking up the kid population early and then not so much later on. These are constant dollars, and you get this huge run-up in expenditures. Between 60 and 80, you had food stamps, you had Head Start, all sorts of programs were introduced. There's always been some sort of dividend for kids that economic growth over most of the last 50 years has provided. The CHIP program, the health insurance program, that was something in the 90s, that big new program for kids. So we're always able to take some amount of the growth that we have enjoyed macroeconomically and channel it toward kids until about 2010. Right, and that amount of money, absolute amount of money in constant dollars, has actually declined. So what's going on? This is also from the KidShare report. If you look at the fraction of the federal budget Federal budget as a percent of GNP has been fairly constant, and divided into what share goes to kids, what share goes to Social Security and health, not related to kids, defense, and then other, that's the top portion. Back in 1970, about 5% of the budget went for child-related expenditures, and about 18% went for Social Security and health. Vietnam War was really big at that time, so a lot more went to defense. By 2000, defense had fallen substantially as a share of overall budget. Social Security and health for non-child population had grown substantially at 34%, but so had the share for kids, right? So not only had the level of the federal budget grown, but the share had grown too. And it grew a little bit more to 2010, to 11%. So 11% of the federal budget was spent on kids. So what's going to happen? Well, we know what happened by 2015, and then we can project these trends out to 2017. And it's very, very discouraging, right? The fraction of the budget that's going to be allocated to Social Security and Medicare went from 38 to 45% between 2010 and 2015, and is projected to go to almost half of the budget. Unless we, reform Social Security and Medicare in a way that's going to cut down on their size. We tried that as a big initiative after George W. Bush was reelected, and it got nowhere. It's a very difficult conversation to have politically, so that's not likely to change. And so what's happening is that the fraction of the budget devoted to kids must necessarily decline. It's hard to see a way around this. So we need to not count on this kind of child dividend that's been something that we've been able to enjoy up until about 10 years ago because it's not likely to continue. So that's the think unambitiously part of this. It all comes from elderly people hoarding money, like me, and my one joke of the day, like Pat Levitt in a few years. So please let Pat know that I told a joke at his expense. Okay, so think about unambitious expenditures. People typically think about very ambitious new expenditures, new service programs, and so forth. These are just illustrations of what Tulsa's trying to put together, a very ambitious early childhood effort that involves EduCare, very high quality, very early care, kind of like early Head Start. But the economics of the costs of these education settings is driven by class size, right? The big cost is the salaries of the care providers. When you limit class sizes to 8, you're spending about $24,000. Early Head Start was $20,000. Head Start is $10,000. So necessarily, when you've got more caregivers per kid, the cost goes way up. And it starts to come down when a class size can go up to 12 at age 2 and 17 and 20 at age 3 and 4. But if you roll it out and provide this kind of center-based care all the way out to age 5, in the 5th year alone, it's about $16,000. It's high quality. Head Start is about $10,000, so this is a bit higher quality Head Start. But if you provide these kind of services all the way across early childhood, you end up $100,000 per child. Right? There's no way in the world that we're going to be able to come up with $100,000 of additional money to spend on kids. So that's why I'm saying you need to be fairly unambitious, but you can be clever. And here, I'm an economist. I have to talk about benefit cost perspectives. This is a paper I did with Catherine Magnuson in Child Development Perspectives called Pennywise and Effect Size Foolish. And it tries to address the obsession with effect sizes that pervade, I think, health and development. It's not about effect size, it's about effect sizes relative to cost. So if I have a home visitation program that has a big positive impact, most don't, but suppose I have a 0.4 of a standard deviation impact on school readiness, and I've got some text messaging program with a much, much smaller 0.08 standard deviation impact. Whenever students come and have done a policy analysis and they show me what the effect sizes are, I say, what's the cost? Because home visitation programs can easily cost $8,000 or more per year. Text messaging programs are very inexpensive. And you can easily end up with a series of complementary, relatively inexpensive programs that cost much, much less than some big, full-scale service delivery program. And unless we've got this kind of benefit-cost perspective and look beyond effect sizes and look instead to, this is from the 1950s, bang for the buck when they were talking about defense expenditures. It's all about effect size relative to cost. So as you think about these ideas for service programs, please think about costs. Finally, think about promoting targeted programs under the guise of universalism. The math is just unavoidable. Right? Here, these are the numbers of children in the millions. For kids below the poverty line, it's about 10 million kids. If you draw the poverty line with the supplemental poverty measure. If you go on up to 150% of the poverty line, you have 26 million kids. If you keep going up to the median income level, it's 37 million, and then the other half above the median is another 37 to give 74 million. So I have a program and I spend, let's say it's $1,000 per child. This is what the cost's going to be. Just multiply those numbers times 1,000. So if you're thinking about, oh, well, let's make this program universal so that everyone will support it politically and it will be effective for low-income kids, you're talking about a much, 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 much more expensive program. So what can we do about this? Well, one approach is to have universal screening, but then refer more expensive services to the subset of high-risk families. Another is to charge families on a sliding scale based on income, if you can do that. And the third thing is to universalize programs already targeting middle and upper income families. That's the child allowance idea that I'll talk about. So the screening universally and then delivering services to a subset, the best example I think is Durham Connects. Some of you know about this. It was universal recruitment in all the birthing hospitals in Durham, North Carolina. And then there were universal visits by public health nurses. The nurses did screening for risk factors, and it was only the families with high risk scores that got referred for services. There was kind of a very high risk and a medium risk that got referred to different kinds of services. There was extensive work done with the service providers in Durham so that they were ready to handle the additional people who would be coming in for services. They were pleased because the referrals were made by public health nurses who really knew what they were doing. So it ended up being quite successful. And the whole purpose was to enable parents to better connect with their kids. So it's been going on for a few years. The only rigorous evaluation of it was a very clever random assignment design where kids born on odd days of the month were offered the program, even days not, right? So, and that was for all births in Durham. So you can take any data set, school records, as long as you know the birthday, you can tell which kids were given these services. This is just one outcome, emergency care visits, and what you find is substantial reductions in emergency care visits for control families, for treatment families. The Durham Connects families relative to control families. Benefit cost analysis, gotta like it. This is just for this one outcome. The cost was about $700 per assigned family. And the benefit cost ratio just on the basis of emergency visits was about $3 saved for every dollar spent, right? And one thing about benefits and costs, the costs stay the same as you continue to follow these kids, and if you observe any more differences that translate into economic benefits, this $3.44 just gets bigger. All right, sliding scale. Suppose I have this $1,000 per child program, but set up a charge for it. I think you can think about this maybe best in the context of a pre-K kind of setting, right, where a high-quality pre-K might be offered, have it be free to low-income families, 25%, well, in this case, $1,000, it's going to be more like $10,000. Don't charge anything for poor kids, charge something, $200 for near poor, charge $500 for below median, $800 for above median income. Who knows what the take-up will be for the higher income families? It won't be zero, but you're not excluding higher income kids from these classrooms, and it's probably good to have a mixture of low and high income kids in classrooms. Depending on the take-up, you can end up with a much, much lower than $74 billion cost by having these co-pays. So the final example is trying to sneak universalism into an already existing benefit, right? And the example here is the child tax credit. The tax reform of 2018 expanded the child tax credit substantially. It doubled the value from $1,000 to $2,000. It expanded the upper limit on eligibility up to $200,000 for a single person family and $400,000 for a married couple family. So as long as you're paying taxes and paying more than $2,000 of taxes, of tax liability, you get $2,000 put in your pocket, right? But that's as long as you've got $2,000 of tax liability. If you don't have that, then you get less or you get nothing. So it's a huge benefit for middle class and upper middle class families. And there's a little bit of refundability there, but essentially none of it goes to low income families, right? So in writing about a child allowance, I think that was circulated to the committee, right? The child allowance. That was done before the tax reform. But all of a sudden, as we thought about it, we realized we already have a child allowance in the country. Between the child tax credit, additional child tax credit, the child exemption, right, in the income tax system, we were spending, before tax reform, $100 billion a year on a child allowance. But it was a clunky child allowance. It was paid once a year, not monthly, when people really need the kind of stability. And it was not going to any really low-income families, right? So the argument for a child allowance would be to simply universalize this child tax credit. So you're just filling in a little bit of this distribution and rebranding it as a child allowance. You eliminate the child tax credit and you put in a $2,000 monthly child allowance. This additional cost is only on the order of $12 or $13 billion, right? So it's very cheap, and if people buy it, it would be a huge benefit for low-income families to be able to get a monthly child allowance. This is a $2,000 annual payment, the annual amount that's paid monthly, right, is the proposal. So it's a way of kind of sneaking, targeting into a nearly universal program. So think broadly, think unambitiously, think cleverly, and think about promoting targeted programs under the guise of universalism. Thanks.